This is a neurosurgical operating room. Unfortunately, this is where many will begin a long, arduous journey of recovery from neurologically devastating conditions stemming from bleeding on the brain, better known as subarachnoid hemorrhage. The most common cause of this bleeding on the brain are brain aneurysms. 6% of Americans harbor these ticking time bombs. This is a very real problem in society today. Some common names having suffered from this type of bleeding include Vice President Joe Biden, music artists Quincy Jones, Bret Michaels, and Neil Young, and actress Sharon Stone. This is also a very catastrophic prognosis if found too late, with many complications. 10 to 15% of brain aneurysm patients will die before ever reaching the hospital, and over 50% will die within the first 30 days after rupture. Of those who survive, about half suffer some permanent neurological deficit. Oftentimes, these come from undiagnosed or poorly treated complications. In fact, up to 40% of these brain aneurysms will have a serious complication at some point in their hospital stay. 1 out of every 5 of these patients will rebleed onto the brain within the first 2 weeks after the initial rupture of the aneurysm. Current treatments include endovascular coiling, which uses the femoral artery in the leg to thread up to the brain aneurysm and to deploy coils to clot the aneurysm. The other treatment includes clip ligation, which involves an open brain surgery to manually place a titanium clip across the neck of the aneurysm. Major academic centers treat brain aneurysms with approximately a 50-50% split between clipping and coiling. There are many advantages to putting a clip on the aneurysm as opposed to using coiling. These include increased durability, direct visualization of the aneurysm, the ability to decompress or essentially deflate the aneurysm after clipping, the ability to inspect other blood vessels in the area for smaller aneurysms. This is important because once you have one aneurysm, a significantly greater rate of further aneurysms exist. In cases of subarachnoid hemorrhage, there is the ability to take out blood clots stuck on the brain, the fact that more complicated arteries just aren't amenable to coiling, and there is also a proven decreased risk of the aneurysm recurring with this type of treatment. The major problem with today's clips is that 100% are made of titanium, which causes severe artifact on CT and MRI. Just think about being in that lucky group that survives, only to face this very bleak future, but to be plagued with the inability for doctors anywhere to accurately diagnose and treat problems with your aneurysm, or your medical complications, not just while in the hospital, but for the rest of your life. I'll give you an example. Say you've had an aneurysm treated with the current titanium clips, and you suffer a serious brain bleed, as 20% will. This is what it should look like. This is what it does look like. Or imagine a patient suffers a serious stroke just after surgery. This is what doctors should see. This is what doctors do see. The inability to check quickly and efficiently on the progress of the aneurysm or of any other possible brain problems is a huge medical issue and one that physicians face each and every day. These patients end up with serious complications from treatable conditions and have significant delays in accurate diagnosis. This in turn costs countless medical dollars and has ruined countless lives. There are currently 2 companies that monopolize the clip market. For instance, Duke University Medical Center utilizes approximately 99% of their clips from one of these makers, all of which are titanium. CranioVation has developed the first zero-artifact aneurysm clip. We use PEEK, or polyether ether ketone, a substance currently extensively used in both orthopedic and spine surgeries. We have innovated different styles of metal-free clips utilizing PEEK only. Here are 2 of our initial designs, both patent pending. These are enlarged, plastic representations of earlier models. We've worked to modify and enhance these designs. As opposed to other companies seeking financing, we are confident that with your capital, we can develop an accepted and approved design that is more efficient and cheaper than the current clips on the market. We also feel we excel in 3 key areas: protected intellectual property, a definable FDA path, and a very real, clearly defined problem. Widespread use of our clips could change the way subarachnoid hemorrhage and aneurysm patients are treated and significantly reduce the cost both of treating the aneurysms and the post-operative complications. Our team includes well-known, successful medical device engineers and some of the best-known names in vascular neurosurgery today. In a perfect world, there would be no artifact. Even better, in a perfect world, we would be able to define the cause of the aneurysms and treat them before they even existed. Until this perfect world exists, we offer a clear and definable solution for a very real and present problem.